I'm Patsi Nystrom. I have a doctorate of nursing practice. I'm going to talk to you today about Alzheimer's versus a normal aging process. Alzheimer's is a progressive disease that affects the brain cells, the neurons in the brain. It affects the patient's ability to think and to reason, their ability to do daily activities. Alzheimer's is not a normal aging process. There are things that happen with normal aging, such as loss of memory, which is usually temporary and not interfering with life itself. But the dementia associated with Alzheimer's is, as I said, progressive, and the patient continues to deteriorate and lose function and language skills, ability to think and reason, to do tasks that require special mental skills such as balancing a checkbook. There are different little mental status tests that we do. Some of them ask, do you know what day it is, what day of the week, what day of the month, where you are at this point in time, and who you are and who's with you, and what is the name of this place, and what town is it in. Two of the tests that I like to do are very simple tests, one of which is a 3-word memorization, and the words are dog, apple, and house. I talk to the patient about the fact that the dog is an animal, and the apple is, of course, food, and the house a place to live or a building. And we just talk about it a little bit to get the words into their mind. Then we put it aside, and 2 minutes later, I ask them to recall those 3 items. If they have Alzheimer's, maybe they can recall one and maybe not any at all. If they have normal aging memory loss, they'll readily recall all 3 items. Typical warning signs would be memory loss, especially of recent events. A typical warning sign of Alzheimer's is confusion for time and place. The Alzheimer's patient might run down to the neighborhood grocery store and 4 hours later return home, or even need a phone call to find their way back home. The Alzheimer's disease patient struggles to complete familiar actions. Brushing teeth becomes a labor, the simple daily process of getting dressed. They have trouble finding appropriate words and completing sentences, certainly have a lot of trouble following directions. They demonstrate poor judgment when making decisions. There are changes in mood and personality, such as increased suspicion. They have rapid mood swings and withdrawal and disinterest in usual activities. Names of persons, placement of objects, and other new information. Caregivers are heroes. They care without reservation for their loved one, often not being appreciated. And it's a 24/7 proposition. Caregivers specialize in communication skills and safety concerns, managing behavioral changes that are very difficult, and activities of living for the Alzheimer patient. They are loving, kind, and patient, seemingly unnoticed by their charge. They have to be protected from burnout and maintain their own physical and mental health despite discouragement, because that's the only way they'll be able to maintain the care that they give. Support systems are very important for caregivers. It's imperative that they have a means of respite, of getting away to exercise and be active and have another life other than just being with the patient every hour of every day. The caregiver has to assume all legal and financial responsibilities. They have the responsibility of long-term planning issues. Caregiver has to know the value of cognitive stimulation activities with their loved one, and they spend hours listening to music, doing word puzzles and memory games as therapy for both patient and caregiver. They know the value of a smile, of giving hugs. They think positive by focusing on their loved ones' remaining strengths and enjoy the relationship as long as they can. But we always encourage caregivers to reach out to support groups. Caregivers are heroes. Presently, there's no proven way to prevent Alzheimer's disease. Research into prevention strategies is ongoing. The strongest evidence so far suggests that you may be able to lower your risk of Alzheimer's disease by reducing your risk of heart disease. Many of the factors that increase the risk of heart disease can also increase your risk for Alzheimer's and vascular dementia. So important factors that may be involved include high blood pressure, high cholesterol, excess weight, and diabetes. Keeping active physically, mentally, and socially may decrease your risk for Alzheimer's and make your life more enjoyable. The hope for Alzheimer's is that there's a lot of ongoing research, and there are some breakthroughs being made. We're much closer to getting the cause determined, and when the cause is well determined, they'll be able to do a better job of getting the medications for a cure.